Hello class, my name is Mrs. Eberly, and today I will be talking to you about malaria, a deadly parasite. Today we will discuss why malaria is important and what it is. We will discuss what parasite is responsible for malaria and how it is transmitted to human hosts. We will discuss the effects of climate change on malaria and what is being done to combat this disease. Even though malaria is a preventable and curable disease, its presence can be felt around the world. According to the World Health Organization, African countries are found to be the most impacted by malaria, with 94% of global cases being located within Nigeria, the Democratic Republic of Congo, Niger, and the United Republic of Tanzania. Of these reported, children under the age of 5 were most affected, with 76% of all deaths being contributed to this age group in 2023. Reports of malaria in the United States via travel to infected countries reaches around 2,000 cases a year. Climate change has affected the tiny organisms responsible for malaria and the 608,000 deaths reported in 2022. Malaria is a disease caused by the tiny protozoan in the genus Plasmodium. Of this genus, the species P. falciparum and P. vivax are most significant. The parasite that causes malaria is transferred to humans through a very specific vector, the female Anopheles mosquito. These parasites develop within the Anopheles mosquito and are passed to humans when feeding. Interestingly, only the female mosquitoes feed off of blood. The male mosquitoes feed from fruits. There is a specific life cycle of Plasmodium within the mosquito, and the cycle continues once this parasite has infected a human. The cycle first starts in the mosquito when it ingests the parasite. From here, the parasite undergoes sexual reproduction and produces a zygote within the mosquito. The zygote implants into the tissue of the mosquito's intestines, where it matures into what is known as an oocyst. The oocyst releases spores through a process known as sporogony. The spores travel to the salivary glands of the mosquito. The next cycle begins when the mosquito bites a human. Once the mosquito has bitten a human, the spores move into the bloodstream, where they then move to the human liver. Here, they take up residence and are now known as trophozoites. The trophozoites multiply by sexual reproduction within the liver. This condition is known as hepatic schizoagony, with the trophozoites bursting open into merozoites. The merozoites cause the symptoms of malaria by attacking the red blood cells of their human hosts. In some individuals, those specifically infected with P. vivax, there can be a period known as latency between the trophozoite and merozoite stages, producing a delay in onset of symptoms. According to the World Health Organization, patients that are infected with malaria experience the following: extreme tiredness and fatigue, impaired consciousness, multiple convulsions, difficulty breathing, dark or bloody urine, jaundice or yellowing of the eyes and skin, and abnormal bleeding. Onset of symptoms is usually 10 to 15 days after the bite. Early treatment before malaria progresses to severe symptoms is paramount in survival. Climate change has allowed for vector-borne illnesses like malaria to migrate to new areas of the world, now becoming a global health concern. Environmental changes related to warmer weather and higher humidity have provided the Anopheles with habitats conducive to longer lifespans. Extreme weather patterns have created flooding events that provide the Anopheles with larger breeding grounds. According to the World Health Organization, in 2023, there were 83 countries with deaths related to malaria illness. Treatments for malaria include anti-malarial drugs, Coartem, Malarone, quinine, and mefloquine. However, drug resistance has made treatments increasingly difficult. Currently, there are 2 vaccinations that can prevent malaria. These vaccines are recommended as childhood vaccines in countries where malaria is most prevalent. Surveillance is key to controlling malaria. By tracking the severity and spread of the disease, researchers and governments can implement strategies to reduce malaria. The Global Technical Strategy for Malaria 2016 to 2030 has set out to achieve the following goals by 2030. Reducing malaria incidence by at least 90%, reducing mortality by at least 90%, and preventing countries that are currently malaria-free from acquiring the disease. Individual preventative measures recommended in addition to vaccination include sleeping under nets that prevent the ability of the mosquito from reaching a human host, covering the body with clothing, again to prevent mosquito bites, while larger scale measures are being taken to eradicate the mosquito altogether. These steps include deploying insecticides, both chemical and natural, as well as introducing predatory fish into the mosquito's environment. These strategies must be implemented with caution, however, as to not cause more harm to the environments in which the mosquito resides. To recap our discussion on malaria, today we discussed why malaria is important and what malaria is. We have discussed what parasite is responsible for malaria and how it is transmitted to human hosts. We have discussed the effects of climate change on malaria, and lastly, what is being done to combat this disease. Our key takeaways are that malaria is a global health concern affecting thousands of people worldwide despite being a preventable disease. We now understand the life cycle of the Plasmodium protozoa and the role of the Anopheles mosquito plays in transmission to human hosts. With this information, you will be better equipped to protect yourself and your family from this deadly parasite.